Hello everyone. Today we will talk about how to take hospital rates for particular treatment. Suppose you have been recommended for a surgery. If it is a laparoscopic hernia surgery, you want to know what is the best rate available for laparoscopic hernia surgery in your city. So there are multiple ways you can take it. So first of all, you need to understand what are the classifications available for hospital verification. So there are different grades of hospitals are available in any city. So it starts from A class to D class. So A class hospital will be the top hospital wherein the services of A class hospitals will be comparable across the A class hospitals. So just to clarify more, in an A-class hospital, if they are having a comparable operating room with another A-class hospital, those operating room facilities are comparable, room services are comparable, diagnostics facilities are comparable, and everything. It is something called apple-to-apple comparison. So that's how they position themselves as a A-class hospital, and they do have certificates also like NABH or JCA accredited hospitals. You would have seen. So those kind of things you need to understand. You may not be, you should not be comparing A grade hospital with a C grade hospital. So you will see a significant difference in the hospital charges. So if you want to compare hospital charges for particular surgery within the same class, which is easily possible. So either you have to approach a hospital by making few phone calls, or you may have to visit them personally. And you can take the calls, but whenever you got a surgical price or surgical charges, you have to do a deep dive into it, because there will be just a summary. They will be saying, like, let's say 1.5 lakhs for one particular surgery. I'm just saying and taking an example only. So you need to figure it out how this 1.5 lakhs are spent in for your treatment. So that is a key in that, okay, whether it's a complete package or you may have to additionally take some extra amount for before completing the treatment. Sometimes you may have to spend for pharmacies and some consumables will be charged on top of it, and you have to deep dive into it. So, but definitely you will see some differences in hospital to hospital, and patient to patient hospital charges will be different. So once you know that this is what my hospital is charging, then you can take a call on whether to continue that hospital. So those kind of decisions you can take. If you are finding difficult to take decisions, you can always reach out to Surgeon Info. So we have plenty of options to getting a transparent hospital rates for your specific needs. Thank you.